let's take a minute to go over this slide. And remember, we're talking about bone markings now. So we're going to talk about first depressions. Now remember, depressions are going to be places in the bone where, or depressions and openings, are places in the bone that make way or make room for soft tissue. And that could be stuff like nerves or blood vessels or something to that effect. So if we look at depressions on the humerus right here, we can see that there's going to be two that they're going to mention. There's going to be a sulcus, which is a narrow groove that we can find near the head of the humerus. That's going to be up here. And then down here we're going to have a fossa, which is a shallow depression, and it's going to be right behind the condyle at the elbow joint of the humerus. So those little depressions right in there. So those are examples of depressions, and like I said, that's the stuff that'll allow for soft tissue to pass through or near a bone. Now, the next ones that we're going to look at are the processes. And remember, the processes are projections where we're going to have tendons or ligaments attach. Okay, so there are places on the bone where softer tissue, connective tissue, is going to attach, so that we can have muscle attachment that allows for movement. Okay, now these processes are going to be very similar ideas. They're going to be little tiny differences on the same theme. All right. So if we look at these three right here, the crest, the spine, and the line, these are all going to be ridges or elevated parts of bone, and they're going to be subtly different. So a crest is a prominent ridge, so something that stands up quite remarkably. A spine is going to be a pointed process, and you can see the spine right here is going to be at the end of the hip bone, so right there, and that's going to be quite pointed, and you can actually feel that if you put your thumb on your hip. A line is going to be a lower ridge, so it's not quite as big as a crest, it's less pronounced. All right, and these are all places where we'll have attachments of ligaments or tendons. A tubercle is going to be a round, small rounded projection, and the two most common ones of those are going to be at the head of the humerus and of the femur. And then we'll have a tuberosity, which is an area of raised growth on the bone, not necessarily growth, but a raised area on the bone that's really rough. So the bone's not going to be smooth there. You may see some pits or some ridges that are, small ridges or lines that go up and down or are a bit bumpy, and we call that a tuberosity. Now we'll also have processes that are formed where we get articulations, which in the skeleton means a joint, where two bones come together. Okay, so we've got a few here. The head and the neck. The neck is going to be a restricted area, so a place where the bone gets quite narrow, and it's usually found at the base of the head. Okay, it's usually at the end. The head is usually at the end of a bone, and it's generally separated from the rest of the bone by a neck, which makes it a pronounced process. If we look down here at the next three in the bottom of this list, the facet, the condyle, and the trochlea, these are all versions of articulating surfaces. And what articulating surfaces means is a place where two bones will come together, where bones will articulate or move against each other. So a facet is a small flat articulated surface. A condyle is a smooth rounded process. So at the bottom of the femur and at the bottom of the humerus, you're going to find condyles. So a small flat process, small flat articulating process. And then we also have the trochlea. These are going to be areas that are rounded, and they kind of look like a pulley, and they have, they serve a function in terms of making a joint a little bit more efficient. So those are different bone markings, depressions, and processes. Okay, so for the next little while, certainly to the end of this video and probably the next one, we're just going to be talking about the skeleton in general, how the bones are organized, where the bones are, what the names and stuff are. So we'll go through, and first we'll start off with the two main groupings of the skeleton. We have the axial skeleton and the appendicular skeleton. So the axial skeleton is actually going to be about 80 bones, and it makes up the framework of the head and the trunk of the body. So if we look at our our picture over here, the axial skeleton is going to be the one that's kind of a yellowish color. The rest of the skeleton is called the appendicular skeleton, and it's 126 bones in total. And what it does is it makes up the extremities, so the arms and the legs, and also the bones that attach the arms and the legs to the skeleton, and we call those girdles. So if we look at the skeleton again, the bones that are in bluish color, those are going to be the appendicular skeleton. So we have the arms, the legs, and we have the girdles, which are the bones that connect the arms and the legs to the axial skeleton. So we have the pectoral girdle that holds the arms, and the pelvic girdle, which holds the legs. So the axial skeleton, of course, it's going to include about 80 bones, and including those are going to be the bones that make up the cranium, the facial bones, the trunk, and the thorax. So 80 bones in total, and the axial skeleton are the bones that we can pretty much find on the axis, the main axis of the skeleton. When we look at the appendicular skeleton, we're going to be looking at the two girdles, the shoulder and the pelvic girdle. And those girdles will hold, respectively, in the shoulder girdle will hold the arms, or the upper extremity, and then the pelvic bones, or the pelvic girdle, will hold the legs, which are the lower extremity. Alright, so let's start with the axial skeleton and start right at the top with the skull, or the cranium. So the cranium is going to consist of 8 different bones, 4 individual bones, and 2 that are paired. So the frontal bone is probably going to be the biggest one. It makes up the top part of your eyes and most of your forehead, almost to the top of your middle of your head. There's going to be 2 parietal bones that are going to make up the sides of your skull. And below those parietal bones, there's going to be 2 temporal bones, and they're going to make up the lower sides of your skull. The next 2, the ethmoid and the sphenoid bones, are going to make up a part of the skull that forms behind your eyes, and it leads to connections with the facial bones. And then finally, the last one there is the occipital bone that you'll see. You won't see in this picture, but it's on the direct back posterior side of the skull. We'll have a look at it in the next picture. Okay, so before we start talking about the facial bones, let's just go over real quick the bones of the skull, because they're pretty easy to see on this side. So one, we've got the frontal bone here. Then we got the pair of parietal bones that make up the blue one that makes up the side at the top of the skull. Below that, we've got the temporal bone, makes up the lower half of the side of the skull. Then we have the occipital bone here, which makes up the dorsal part of the posterior part of the skull, and it also takes up almost all of the space at the bottom of the brain, so that the inferior part of the inside part of the skull. Then we'll have the ethmoid bone out here towards the front. That's going to be one that makes connection with the facial bones. And then the sphenoid, where you can see right here, is going to be the purple one. Those are all the bones that make up the cranium. So between the last slide, the pictures on the last slide, and what we just talked about, you should be able to find the bones of the cranium, no problem. Okay, so let's have a look at the facial bones now, and you can see from the title there, it's 14 bones plus 7. Okay, now where the plus 7 is coming from, let's talk about that real quick. Inside the ears, so if we look at the external auditory meatus, this area here, inside that there's going to be 3 little bones that we call the ossicles, and those are going to form the inner ear. So 3 little bones in there that help translate vibration into sound. So we've got one of those on each side of the head, so that's 3 plus 3. And then below the mandible is a bone called the hyoid bone. And there's one of those, and it kind of floats at the base of the neck underneath the jawline. So this right here, those 7 bones, that's the 7 bones up here that we're talking about. The rest of the 14 bones are going to go and make up directly the face. The most easiest recognizable one is going to be the mandible, the jaw. So here we've got our mandible here, and that's the only one on the skull that really moves. Most of the other bones on the skull are fixed, so they don't have any room for movement. On top of the mandible, there's going to be 2 maxilla, which is going to make up your top jaw. So where the top dental arches or top teeth are going to be held in the maxilla. There's 2 of those bones. It's split in the middle, and there's a left and a right side. On top of that, we're going to have the zygomatic bone, and the zygomatic bone is going to be your cheekbone. So if you push against the space underneath your eye, your cheek, that's going to be your zygomatic bones. All right, there's one on the left and the right side. The zygomatic bone and the temporal bone make up a process here called the zygomatic arch. So that's the zygomatic arch right there. And what that does is it allows muscle connection. So the muscle for the jaw will connect along the surface here of the jaw. It'll move up and pass underneath the zygomatic arch, and then the muscle will fan out and attach up into the temporal and the frontal bone. And that's how the musculature of the jaw is set up. So the zygomatic bone helps with that. Now these next ones, the nasal bones, the lacrimal bones, the vomer, the palatine bones, and the inferior nasal conchae, these are all going to be bones that are going to be between the lower parts of the eye, the nose, and the top of the roof of the mouth. They're generally much smaller bones, and they shape the inside part of the face. Some of the bones here are pretty a little bit easier to see. The nasal bones, for example, if you hold the top part of your nose, you'll feel the rigid part of the bone there, the part of the bone that's not flexible. Those are going to be your nasal bones. Right posterior to that, we're going to have the lacrimal bones, and it forms a part of the eye socket. The vomer is on the inside part of the front part of the skull, and it actually makes up the bone that attaches the maxilla, so it's a little bit above the roof of the mouth. And then the palatine bones are going to be the bone that's right behind the soft palate in the back of your throat, towards the top of your mouth. And then the 2 inferior nasal conchae, those are going to be a little bit directly behind your nose, and they're going to shape some of the nasal cavities. So that's the facial bones and the cranium. You're probably asking why we have so many different bones in the skull and in the face, and the reason why is when we're born with different, or as we're being developed in the womb, the bones develop from different growth centers, and what results is each one of those growth centers will get credit for being a bone, and it goes through that process of ossification that we talked about yesterday. And we have this calcification. It occurs in different places in different forms. If we look at an infant skull, so this is an example of an infant skull right here, you can see most of those bones that we talked about, the skull and the facial bones, and they're going to start to ossify at different rates. Now, as they're doing that, there's going to be places in between those bones that are made up of cartilage. Now, those places that are made up of cartilage are called fontanelles. And the fontanelles are often called the soft spots on a baby's head, and they're called soft because it's not rigid bone, and it's not actually really soft. It is made of cartilage, so it's a really sturdy structure, but it isn't bone. So in comparison to bone, it'll feel quite soft. And you can see these fontanelles if we look back at the top 2 figures here. The fontanelles are going to be these gray areas. And where they are, they show spaces in between the bone where the bone hasn't joined up yet. So those are going to be your soft spots. And there's a few reasons for having those soft spots. It allows for the skull to grow, so we can have maximized brain capacity. And it also allows for the baby to fit out through the birth canal a little bit easier during the birthing process. Now, those bones are going to grow together as they go older. You guys all know that our soft spots don't last forever, and where these bones join together, we call those sutures. And there are prominent sutures all over the skull which separates the different bones of the cranium and the face.